Welcome to The Explainer. Today we're diving into a really devastating lung disease that honestly has a pretty grim prognosis. But what if we could do more than just slow it down? We're going to explore a new kind of treatment that doesn't just manage symptoms, it actually aims to regenerate the lung itself.
So here's our game plan. First, we'll get a handle on what pulmonary fibrosis really is. Then, we'll look at a groundbreaking new approach using aTPSCs. We'll break down the clever method they use, see how it actually rebuilds the lung tissue, check out the incredible clinical results, and then wrap up by thinking about what this all means for the future.
All right, let's jump right in. To really get what's going on here, we first have to understand the disease we're up against, idiopathic pulmonary fibrosis. So, at its core, IPF is a relentless scarring process. Think about the most delicate, most critical parts of your lungs. That tiny space between the air sacs and your blood vessels. That's where this scar tissue just starts to build up, creating a physical wall that blocks the essential job of getting oxygen into your blood.
And the effect is just devastating. As more and more of this scar tissue forms, the lungs get stiffer and stiffer, and every single breath becomes a real struggle. It is literally like the lungs are being suffocated from the inside.
For patients, the reality is just grim. We're talking about a degenerative disease, and the idiopathic part means we don't even know what causes it. Once you're diagnosed, the median life expectancy is a stark 2 to 5 years. And maybe the most important part, current treatments can't reverse it. All they can do is try to slow down the inevitable.
But what if we could change that? What if we could actually move beyond just slowing the disease and start to repair the damage, to rebuild what's been lost? Well, this is where a completely different kind of stem cell comes into play.
You know, most of the stem cell trials for IPF have used something called mesenchymal stem cells, or MSCs, and they do have some benefits. They can reduce inflammation. But when it comes to actually reversing the damage, the results have been, and this is a quote from researchers, less than stellar. The approach we're talking about today uses adult telomerase-positive stem cells, aTPSCs for short, and they have a totally different mission. It's not just about soothing the problem, it's about actively rebuilding the lung tissue from the ground up.
So this is the key, right here, this hypothesis. It's not about managing the decline anymore, it's about reversing it. This one idea completely shifts the paradigm from just making patients comfortable to actively, functionally regenerating the organ.
So how on earth does that actually work? I mean, you can't just flood the body with cells and hope for the best. Rebuilding an organ requires a really clever dual delivery strategy.
And the logic behind this treatment is, frankly, brilliant. It all starts by recognizing that a lung isn't just one big piece of tissue. It's a really complex mix of inner linings, a structural framework, blood vessels, and to truly fix it, you have to repair every single one of those components.
And this is how they do it, a two-pronged attack. First, there's the inside job. The patient actually inhales a mist from a nebulizer that contains specific stem cells, TSCs and PSCs. These go right to work on the delicate inner linings of the air sacs. But at the same time, the support crew, a different set of cells called MesoSCs, is delivered through an IV. Their job is to travel through the bloodstream and rebuild the lung's entire structural framework and all the tiny blood vessels.
Now, this whole dual strategy is absolutely essential because if you go way back to embryology, the lung is actually built from two fundamentally different types of tissue, and you've got to repair both if you want to restore function.
The house analogy really makes this click. The inhaled cells, they're like your specialized finishing crew. They're the ones painting the walls and putting in the delicate fixtures inside the rooms, the linings of the air sacs. Meanwhile, the cells from the IV, they're the construction crew. They're building the foundation, the walls, the framework, and running all the plumbing and wiring, the lung's physical structure and its blood supply.
Okay, so let's walk through it. Step 1, the patient breathes in the TSCs and PSCs. They go to work regenerating those delicate inner linings, the endodermal tissue. Step 2, the MesoSCs are infused, and they travel through the blood to rebuild the mesodermal tissues, the stroma, the capillaries. And Step 3, the big payoff, these two teams work together to form brand new, fully functional gas exchange units. They're actually reversing the damage from the disease.
All right, so the theory is elegant, the strategy is super clever, but did it actually work in people? Let's take a look at the incredible results from a small but really powerful clinical safety study. To see if it worked, researchers used a standard test for lung function called FEV1. It's pretty simple. It just measures how much air you can forcefully blow out in 1 second. A lower number means your lungs aren't working as well.
Now, the people in this study were not in the early stages of the disease. They were classified as very severe, which is the most advanced stage. Their lung function was already below 30% of normal. So really, any improvement at all would be a huge deal.
So let's look at patient number 1, an 80-year-old woman whose lung function was down to just 14% of normal. After one single treatment, it went up to 27%. Now, I know 14 to 27 might not sound like a life-altering jump, but think about what that means functionally. It's a 93% effective increase in her lung capacity, almost double. That's absolutely staggering.
And the second patient's results, well, they were even more dramatic. A 61-year-old man starting at 25% lung function. After his treatment, his FEV1 shot up to 70%. That is a 180% effective increase. He nearly tripled his functional lung capacity.
And here's the most remarkable part. These weren't just some temporary boost. These incredible, truly life-changing improvements have stayed stable for more than 8 years. That points to a durable, long-term regeneration of the lung.
So the success of this targeted multi-tissue approach, it's not just a potential game changer for lung disease. It's opening up a whole new frontier in medicine.
The big idea here, the main takeaway, is that this represents a fundamental shift. We are literally witnessing medicine move from just slowing down degenerative diseases to actively and functionally regenerating complex human organs.
And the success here, in one of our most complex organs, it leaves us with a really provocative and hopeful question. This same technology has already shown promise in things like heart disease, brain conditions, and the immune system. So if we can successfully teach the body to rebuild a scarred lung, where does the future of regeneration take us next?